Hello everyone, welcome to a new session in hematology. So today we are going to discuss a more practical aspect, that is bone marrow biopsy and aspiration. See, as far as an undergraduate student is concerned, these two terminologies, that is bone marrow biopsy and aspiration, it appears to be so similar, but in reality it's not like that. Fine, there is a very broad and a very vast difference in the procedure, staining, okay, and the indications and contraindications as well as the complications of bone marrow biopsy as well as aspiration. So today I'm just going to give you a very basic idea about bone marrow biopsy aspiration. What are the various biopsy and aspiration needles that we use? Okay, what are the differences? What is the site? What are the stainings we will use? What are the indications? What are the contraindications? And what are the complications following each of these procedures? First, just focus on this table. See, bone marrow aspiration. Okay, so we are going to aspirate something. So you can imagine when aspiration is possible. Yes, that means something like fluid should be present. Whereas biopsy, it's not like that. Imagine two conditions. I am filling a balloon with the water, okay, and using a needle I try to aspirate the fluid. That is aspiration. The same balloon I am filling it with the ice cream. I try to get it. So you can very clearly understand in the first case, in case of aspiration, the fluid will comes very easily, whereas that's not the case with an ice cream. Or imagine you yourself going to an ice cream shop. You are ordering a fresh juice and you are ordering a chocolate shake. Okay, juice. Okay, you will sip fast and you will finish it within a minute. That's not the case with the a sharjah or a chocolate shake. Okay, it will take some time. No, okay, you have to suck. You have to apply a lot of pressure. You have to suck with a very high pressure to get the solid ice cream into the straw. So this is actually the difference between bone marrow aspiration and biopsy. First, let us see what is the site. See, both, whether it is an aspiration or biopsy, the site almost remains the same. That is the posterior superior iliac crest. Okay, don't focus on this table. Okay, posterior superior iliac crest is the site for bone marrow aspiration as well as biopsy. I am writing here bone marrow aspiration and bone marrow biopsy. This is the site. Of course, in various textbooks, just for theoretical purpose, if they ask you, you can write iliac spine, sternum, medial aspect of tibia, spinous process of the vertebra. These are the other sites. Okay, bone marrow aspiration and biopsy, they will ask in your practical. Okay, in aspiration, what all we can do? We can understand the morphology of the cells. Okay, we can do cytochemistry, immunohistochemistry, we can do culture, and we can do ion staining. So imagine aspiration is like a fluid. In fluid, we can do all these things. Whereas biopsy, it's like a solid. Solid means, remember, cellularity, architecture, fibrosis, bone structure, everything. See, imagine the bone marrow, if it is completely fibrosed, will you be able to aspirate anything? No. Yes, if I told the case of drinking a sharjah or an vanilla shake. Yes, can you suck all at once like a juice? No, definitely not. So imagine that is the condition like a fibrosis. When the bone marrow undergo completely fibrosed, you cannot aspirate and you will get something what we call it as dry tap. So in all conditions where the bone marrow is fibrosed, we cannot do a bone marrow aspiration. All those conditions we will do what we call it as bone marrow biopsy, because in bone marrow biopsy we are going so deep so that we can finally the cellularity, architecture, fibrosis, bone structure, focal lesions, everything can be very clearly made out in a bone marrow biopsy. Fine? Yes. Okay, then coming into the main indications. Okay, main indications. Almost all cases we will do bone marrow aspiration. Just remember like this for an undergraduate level. Except, okay, whenever there is a dry tap, whenever there is an aplastic anemia, whenever there is a myelofibrosis, whenever there is a hairy cell leukemia. So what are the condition? When if you are doing a bone marrow aspiration, okay, suppose you are doing a bone marrow aspiration, you get a dry tap, immediately ask the patient to do a bone marrow biopsy. That is the first indication. Second indication, in case of aplastic anemia, you can imagine, you will learn, okay, I will put a, in aplastic anemia, when we will be discussing, I will be telling, in aplastic anemia, the bone marrow is hyperproliferated. There will be very, okay, the bone marrow is almost full and full of fat, okay, all the erythroid, myeloid, lymphoid, all the precursors, it will be very less, okay, and the bone marrow will be completely replaced by fat. So in that case, we can go for a biopsy. In primary myelofibrosis, which is a type of myeloproliferative neoplasm that we will discuss, okay, that again, and we have something what we call as hairy cell leukemia. So these are some of the common indications for bone marrow biopsy. If you tell this itself, the examiner will be extremely happy. What are the needles we are using? So the name of needle for aspiration is called Sala and Klima. I will show the picture. And for biopsy, it is called as Jamshidi. Then what are the stains? Okay, what are the stains? Here comes the question. Iron staining, that is the hemosiderin, Prussian blue. All those staining can be performed only in case of bone marrow aspiration, not in case of bone marrow biopsy. This is a potential MCQ question you may get in your exams. Then we will use the normal Romanovsky group of stain, that is May Grunwald, Jimsa, field stain, Wright stain. All these are the Romanovsky group of stains. All these Romanovsky group of stains only we will use for aspiration. Whereas in biopsy, we are using our conventional hematoxylin and eosin staining and reticulin staining. Reticulin staining is for bone marrow fibrosis. Fine. And remember, in both aspiration and biopsy, we can do what cytogenetics as well as immunohistochemistry. And time of report, usually the same day in case of aspiration. For biopsy, it will take up to 7 days. Okay. Coming into what are the indications for bone marrow aspiration. Red cell disorders, almost all red cell disorders except aplastic anemia. Leukocyte disorders, almost all leukemias and except hairy cell leukemia. Megakaryocyte platelet disorders, myeloproliferative neoplasm except primary myelofibrosis. Myelodysplastic syndrome, paraproteinemias like multiple myeloma, Waldenstrom macroglobulinemia, monoclonal gammopathy of undetermined significance. Okay, all infections. Whereas in focal lesions, you will prefer bone marrow biopsy. Iron store, I told you, iron staining we will do only in case of aspiration. In case of any metastasis, okay, and if we are going to what to do a bone marrow transplantation, before that, in order to assess the the features of bone marrow, we will do for a bone marrow aspiration. Then where will you case of a bone marrow biopsy? Whenever we want to assess the marrow cellularity, fibrosis, focal lesions, aplastic anemia, okay. Then staging of Hodgkin's lymphoma, very very important. This question has been asked a few years back in AIMS, okay. What will you do in case of a staging of lymphoma? In case of staging of lymphoma, we will always do a bone marrow biopsy. Okay, normally to find whether the patient is having lymphoma or not, we will do bone marrow aspiration. But in order to stage the disease, we have a lot of stagings in all the Hodgkin's and non-Hodgkin's lymphoma that you will see in WBC disorders. For staging purpose alone, we will do bone marrow biopsy. Okay, then I told you, hairy cell leukemia. Don't forget about the other terms. Hairy cell leukemia is what you have to remember. Then remember what to say. To suspect any primary amyloidosis, then any bone disease, focal lesions, and remember staging of Hodgkin's, non-Hodgkin's lymphoma. In all these cases, we will do bone marrow biopsy. Then what are the contraindications? Okay, contraindications means the number one contraindications is whenever there is a marked osteoporosis. Okay, whenever there is a coagulopathy, in that case, remember bone marrow biopsy is mainly contraindicated. Okay, yes, and remember a very very important point: isolated thrombocytopenia is not a contraindication for any of these procedures. What are the complications? The most important complication is hemorrhage, then infection, continued pain at the procedure site, any puncture of this sternum. Sometimes the sternum will get punctured and the patient may develop pericardial tamponade. Okay, yes. Then coming into what are the needles. See, you can see a very first, you can see a needle here. Yes, very first you can see a needle here. Okay, I am not drawing anything. I think you can very well observe this needle. This needle is what we call it as Sala. Okay, this is what we call it as the Sala. Sala and Klima and Islam. Sala, Klima and Islam. Remember these three. The what needle which is shown here is Sala. Okay, please take a print of this image and in your retina and store it in your cortex. This is a very commonly kept bone marrow aspiration needle for your practical exam. They will ask you what is it. It is a bone marrow aspiration needle. There is no need that you have to name it as Sala, Climora. Just say it is a bone marrow aspiration needle. Okay. Then they will ask you what is the aspiration, what is biopsy, indication, complication. Okay. All those tips I have already told you. Okay. Then rest all stains. See, you can see it has a like a rectangular structure. Then you can see an extra screw through. So this you can very clearly differentiate when this straight needles. See, these are all straight needles without any bends. This is what we call as bone marrow biopsy needles. Okay, this is the classical name of bone marrow biopsy needle that we use everywhere is Jamshidi. Okay, what is the name of the needle? Called as Jamshidi needle. See, this is the same Jamshidi needle, but an extra plastic handle has been attached for doing procedure very easily. Okay, yeah, to hold it very firmly, we have attached a plastic board. Okay, this is the actually, see, this is how the see, you can see this is how the bone marrow biopsy is being performed. Okay, remember what is that? Sala and Jamshidi needle. Okay, remember Jamshidi needle is an autoclavable. Okay, all this is autoclavable needle. Okay, yes. So Sala, Klimma and Islam is for aspiration, and Jamshidi needle. Okay, Jamshidi needle, remember. See, and okay, yeah. So Jamshidi needle, the gauge size is 6 to 12 gauge. There is no need that you have to remember all this. Just you should know how to identify the slide. Okay, what is the picture? Okay, the needle. This is Jamshidi and this is Sala. Okay, Sala, Klimma and Islam. Fine. Yes. Okay. Once you are this any of these needles will be kept, they will ask you, okay, what is it? So sir, it is a bone marrow aspiration needle, it is a bone marrow biopsy needle. Then they will go, what are the indications, complications, so and so. Okay, already we have discussed what are the indications, contraindications and stuff. Okay, then suppose we are doing an aspirate. I told you what is the stain? Giemsa, ion staining, cytochemistry, immunohistochemistry. The same cyto and immunohistochemistry we can do for what? Tryphin biopsy, but in biopsy we will do what is the hematoxyl eosin staining. For fibrosis, what is the name of the staining? Reticulin stain. Okay, and aspirin. Okay, what else? Yes, the same thing. Okay, again Giemsa. Giemsa, imprint smears. Okay, I'm not discussing now. That's not needed. Just remember two things: aspirate and tryphin biopsy. Okay, hematoxyl eosin staining, and here Giemsa and ion staining. Very very important MCQ, ion staining. Then another important MCQ, for staging of lymphoma we will use always biopsy, but for diagnosis we will always use aspiration. But for staging purposes alone we will use bone marrow biopsy. Okay, yes. So this is a very more practical point. Okay, this is because bone marrow biopsy and aspiration. Bone marrow aspiration, it's one of the very common. I think whenever a patient comes with severe anemia, everything, we will always ask the patient to do a bone marrow aspiration. So you should know what is the difference, what is the site, okay, what is the staining, what are the contraindications, complications, everything. So it's like a more clinically or like a more practical aspect than a theory one. Okay, fine. So I hope you have enjoyed this session. Thank you.